We talk about all these coincidences. Hospital beds are disappearing, especially in Illinois, where Governor Pritzker, one of the more authoritarian, totalitarian of these governors, is there. And so this is a very interesting article from wirepoints.org. Now, when I reported about the ultimatum that was happening in Austria, you had the government there say, we've got 2,000 ICU beds. And if that goes down by 25%, we go down to, we lose a quarter of those, 500 beds, we're going to lock you guys down harder than you can imagine. There's a threat. We're going to do this, we're going to do that, and we're going to do this to the unvaccinated people, you awful unvaccinated people. You're to blame for our disappearance of 500 ICU beds or whatever. But I had a listener who contacted me, and I think, I'm just going from memory now, but I believe that the listener had a family who still lived in Austria. He's somebody who was living in and around various places in Europe. And he said that they were told by a doctor there before this ultimatum happened. The doctor was not responding to what the government had said, but the doctor had been talking to them, said, I don't understand what's going on. We used to have 2,500 beds in Austria, ICU beds. And all of a sudden they just disappeared. Now we've only got 2,000. And then the government comes in and says, and you know what? If we have 500 of those occupied, we're going to lock you down real hard. Kind of looks like they're trying to make that happen, doesn't it? And now, lo and behold, essentially the same thing is happening in Illinois. It's almost like there's some kind of a, global tactic to do this type of stuff. Here's what's happening. And this person who wrote this article at WirePoints, he doesn't know what happened in Austria. He doesn't make a connection to what happened in Austria. But he says this about what's going on in Illinois. He said the key reasons given for why Illinoisians, I guess, is that how you pronounce it, should put up with what's happened is that we have to protect the hospitals, right? So now they fire all the nurses. But anyway, he says, so why has Pritzker, if his whole point and the rationale for doing all of the mandates and the mask mandates, the vaccine mandates, the lockdowns, and all the rest of the stuff, if that was about protecting hospital capacity, how could it be that over 2020, from July 1st, 2020 until now, they have seen their ICU beds go from 4,000 to 3,000. They've lost a quarter of their ICU beds, just like Austria. They had a disappearance of 1/5 of their ICU beds. And then they use the fact they don't have enough ICU beds to push the extension of this pandemic. Total ICU beds, according to the Illinois Department of Health, have collapsed by 25%. The state had nearly 4,000 ICU beds in July of 2020. Today, that number has dropped to less than 3,000. That is intolerable, says this author, given that Governor and Chicago Mayor Lightfoot and others keep using the excuse of hospital capacity to extend their draconian policies. At the onset of the pandemic, I argued on Public Affairs, March of 2020, this author is Ted Dabrowski, that beds were the one area where I thought Pritzker could and should overinvest in. Ensure that beds and hospital capacity, but keep the economy and the schools open. That was the best way to protect lives and livelihoods. See, the problem is that Ted, I think, because he's not a conspiracy theorist like me, because he's not a cynical observer who doesn't believe in coincidences like me, he keeps thinking that this is all about health somehow, right? So how could they be this incompetent? Exactly. How could they be that incompetent? Instead, he said, we remember what happened. We saw Pritzker lock down the entire state despite beds being available. Fast forward to today, and they've lost a quarter of the beds. What's going on? Staff shortages, they say, is likely to be their biggest defense for the lack of ICU bed capacity. How'd they get the staff shortages? They told the people who had been there throughout the pandemic, you either get the jab or you're gone. And the people who had been there throughout the pandemic and had seen the pandemic and had seen the side effects from the vaccine said, hasta la vista, baby. I'm out of here. But that response, he said, should have opened up a whole new line of inquiry from reporters about staff shortages. He said, we've got $3.6 billion in Illinois in unused federal COVID support. Stop and think about this. Trump and his helicopter cash throughout the pandemic. He was giving these Democrats so much money they couldn't spend it all. You had a situation with Newsom where they had a massive deficit. If I remember correctly, it was about $15 billion. And then all of a sudden, after all this helicopter cash, they come out with $50, $60 billion surplus. Newsom. Trump helped Newsom. He gave him more money than he could spend, and he did it in Illinois. To that Democrat tyrant as well. But $3.6 billion they still haven't been able to waste. And that's what they're doing. They're wasting it. They're using it for political power. And that's how Trump used the helicopter cash, to make sure that this lockdown pandemic was going to go through. So he gave these Democrats more money than a Democrat can spend. So who's the bigger criminal? We got these Democrats, as Ronald Reagan said. We've heard that the Democrats spend money like a drunken sailor. That's unfair to a drunken sailor. They can outspend a drunken sailor big time. And yet they couldn't outspend the amount of money that Trump was showering on them while Main Street businesses were shuttering everywhere. Oh, I've got the PPP plan for you. I'm going to give you some money. And yet, instead of giving it to the small companies, he gave it to the big companies and to himself. So no matter how bad, how tyrannical Pritzker was, Trump kept the cash coming. Mountains and fountains of cash. It was like a fire hose of cash. New York Governor Kathy Hochul, she needs to have some speechwriters because she's making some amazing statements just off the top of her head. She says, we don't have clear data on our hospitals filling up. She let the cat out of the bag, says Information Liberation, by revealing that the state has no idea how many COVID patients are actually being hospitalized because they're sick with COVID. We've seen a little bit of this said by Fauci. See, we got all these, you got the kids coming in, they might come in with a broken arm or something. We give them a COVID test. Well, they're not a COVID case, right? We got surges everywhere, but that ain't one. And so, he's kind of pouring cold water on that a little bit. And now we have a New York governor pouring cold water on these COVID numbers. Now, when I was doing that, I was declared to be some kind of wild-eyed conspiracy theorist because I didn't believe their numbers. Now they're telling you that their numbers are not believable. What do you think is going on with that? Listen to what she had to say. So we're looking at a critical moment, said Governor Kathy Hochul, who is in New York now, but we're going to start asking some questions. And maybe we should have started asking those questions 665 days ago. She said, we're talked about hospitalizations, and I've always wondered, are we looking at the hospitalizations of people testing positive in a hospital after they get there? We just had that information come from the UK. They said 1/3 of the people that are positive cases are people who got sick or tested positive at least, not necessarily got sick, but tested positive after they got to the hospital for something else. I suspect that number is quite a bit higher, actually. She says, is that person in the hospital there because of COVID? Or did they show up there and are routinely tested and showing positive, and they may have been asymptomatic or even just had the sniffles? Wow. She sounds like me. Now the next question you might ask, not just about the people who are in the hospitals, but the people who are in the morgues. Did they die of COVID? Did they die with COVID, from COVID? Right? Someone is in a car accident, she said, and they go to the emergency room and they test positive for COVID while they're there. They're not there to be treated for COVID. And of course, we've seen situations, people dying in car accidents, dying in a motorcycle. I think it was over in Houston where he had somebody died in a motorcycle crash, and the guy put cause of death, COVID. And they questioned him on that. He goes, well, it could have been. Could have been. Are you kidding me? What, did he sneeze while he was driving really fast on a motorcycle? What ridiculous stuff. Now, the New York Times, we had the flu that disappeared. Well, the flu's come back. And now it's got a new name. I'll be back. It is now called Omicron. The New York Times is saying this. We got Fauci, we got the New York governor, we got the New York Times telling us maybe this stuff isn't real. Interesting, isn't it? A New York Times columnist who has been following this closely, writes W&D, observes that the data indicates that the Omicron variant is roughly at the same risk level as a seasonal flu. The common man. They created Common Core to dumb down our children. They created Common Pass to track and control us. Their Commons Project to make sure the commoners own nothing. And the communist future. They see the common man as simple, unsophisticated, ordinary. But each of us has worth and dignity created in the image of God. That is what we have in common. That is what they want to take away. Their most powerful weapons are isolation, deception, intimidation. They desire to know everything about us while they hide everything from us. It's time to turn that around and expose what they want to hide. Please share the information and links you'll find at thedavidknightshow.com. Thank you for listening. Thank you for sharing. If you can't support us financially, please keep us in your prayers. thedavidknightshow.com.